gotta go with the straight up water. I gotta teach tomorrow morning. I gotta be at Hampton Bays Middle School at 7:15. So.
Ouch.
You're a fucking teacher too?
Yes, I am. Did I not tell you that? Did you not know that?
Jesus.
Yeah, he competes with Andrew.
This guy's got a fucking bucket list.
The most, for the most occupations.
Actually, it's a bucket list.
Oh, all right. So if you find a patient who is having a sudden sharp pain to the left side of the chest, followed by trouble breathing, status post a painful lower left leg, what do you anticipate that patient's chief complaint should be?
Blood clot.
Pulmonary embolism or thrombosis?
There we go. Moving on. Blood clot, yes. The general gist of that one is, in fact, blood clot.
Genius.
Severe, unrelenting upper right quadrant epigastric pain that might refer to the right shoulder.
Upper right, that's the liver.
Gallbladder, one of those.
Gallbladder. What's the official name for a gallbladder?
Gallbladder? No. Got it. No.
Look that up. The
Is
official...
it cholecystitis?
Oh wait, cholecystitis.
Cholecystitis. There you go.
That's the affliction, right? Cholecystitis, inflammation of the gallbladder.
Yes.
Yeah.
Perfect.
Can't even pronounce that word.
All right. This one I couldn't answer either, so I'm just gonna read it to you. Endocrine manifestations of uremia include. Apparently, the answer is osteomalacia. Keyboard cat.
Yeah, I'm sorry.
Yeah, I got it.
I can't type that fast. I'm stuck in
I have it. I'm going. We got the recording.
When obtaining a gynecological history, what's the good questions to use regarding the last menstrual period?
I'm not touching this one.
Don't.
Pregnancy, menstrual period.
That's the brain
Questions. Patient assessment questions. There you go. What causes the blood to thicken in primary polycythemia?
Too much clotting. Or like platelets sticking together. No? Anybody else?
Matt?
Not enough water.
Why is there not enough water?
Dehydration.
Motherfucker,
Ooh.
no. That's the same as not enough water.
Why not enough water?
Yes, why is there
Oh,
not
yes,
enough
sir.
water? What's taking up that space instead? Acute kidney failure.
I'm sorry. What was the term?
Polycythemia.
Thrombopolycythemia.
No,
got
just
it.
polycythemia. What causes thrombosis or the blood to thicken in polycythemia?
Is today Thursday?
Yes.
Sorry.
It's okay. I thought it was Thursday 2 days ago. Patients with acute kidney failure. How much urine are they secreting or not secreting to be considered oligoric?
Oligoric would be they would be a reduced amount of urine, and the amount, God, I have no idea.
Less than 500 milliliters, 24 hours.
You're over here on my screen, so.
Yeah. All right. 2,500 milliliters in 24 hours.
No, 500. Less than 500.
500. Got it. 500. Thank you.
Ascites is usually related to which disease of which organ?
Heart failure.
There's a couple, one or two other organs too, so look that up. Mild signs of PID.
Of what?
Aha, PID.
Pelvic inflammatory disease.
Oh,
ding,
yeah.
ding, ding.
This would be the shuffling walk. They'd have the little shuffle walk.
That disease, the shuffle walk disease.
With the ascites one, would that be the liver?
Perhaps. What is a really good thing a good assessment question to ask asthmatic patients because it increases their risk for respiratory arrest?
When's the last time were you ever intubated before? Prior intubation.
Fever, headache,
Stay
and
with us.
unilaterally sore throat.
I'm sorry, what was that again?
Patient
Fever
with a
with
fever, headache, and unilaterally sore throat.
COVID-19.
That should be the answer. That'd be hilarious.
What you're looking for the condition?
Yep.
yeah.
Bullshit.
Epiglottitis? No, never mind.
It's the oh crap. What's it called? I know where to find it.
Okay,
Okay.
move on. We'll get
He's
it.
like, I see it in my head in the textbook. Characteristic of appendicitis. What is characteristic
name-
of appendicitis?
That name for it, which I don't remember, is that a lower right hand bounce rebound pain.
Okay, good.
There's a name for it.
Is it the McBurney point?
Yes, that's it. Thank you. No.
That's awkward.
She sucked me in on that one, man.
Yes, because
It's
that's the distractor answer.
Is it something about like an
Nice.
Ellis person?
The what?
Never mind. You just continue. Fucking hate school.
You tried, Matt.
He tries so hard.
Good day for it.
Well, what's the answer?
Well, I don't know. What's the answer, Matt?
You can't give it to us. Come on, somebody should be looking this up really fast while I'm typing, man. Jonathan, that's you, man.
He's already working on the last one. What causes issues with eardrums?
That would be like in kids, buildup of fluid. There might be traumatic reasons, explosive blasts, and so forth.
Yes, but like most common run of the mill. Don't
Like
think,
earwax build.
don't think too hard about this question.
Okay.
Um,
Ear.
What should you do when managing a patient with a surgical anastomosis? Google anastomosis is probably the first thing, Matt.
I was gonna
No
say.
faith.
Right there.
No faith, but I'm gonna do that for the class.
There you go.
Anastenosis would
something.
say what?
I don't know. Stenosis, narrowing of something. I don't know what the ano part is.
A
Maybe
cross
it's-
connection between adjacent channels.
So, surgical
What is-
anastenosis.
So what is the most common patient you may anticipate a surgical anastomosis in?
Dialysis patients.
Yeah.
Amelia's right
Dialysis.
here, so I'm just gonna.
No, Emilio's right there. I gotta go over Archie, but he's there.
Amelia's
So
over
the
here.
That was my one and done, by the way.
I'm out.
Hmm.
So, if you have a patient who has a surgical anastomosis, I can't. Anastomosis. I literally have to look at that word to say it. Yeah, you'll get it. If you understand what a surgical anastomosis is, you'll be okay. When is vaginitis most common?
That would be with regard to sexually transmitted disease like chlamydia or yeast infection.
Age.
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 Oh. Okay. It's been a while. It's been a while.
Joe, you want to go out next weekend? Come on, I got you. You got the Bordy Barn out by you. Come on.
Dude,
Is that even open this year?
I think the smiley faces are put on hold until next summer, if at all. Bordy
Yeah,
Barn,
I'm
maybe that's funny though that you should mention that.
If you survive Bordy Barn, you're immune to COVID-19. Like, it's just
Dude.
nothing about that.
Dude, I survived Bordy Barn from the 70s and the 80s for crying out loud.
Jesus Christ, Joe. That wasn't even fucking a thought.
I know. How about that? You like that? You like them apples? 40 bar, 1982, man.
Got
He's
the
still
shirt.
got the smiley sticker.
Yeah. Got a wall full of them.
Oh Jesus! All right, moving on. Endocrine hormones. How do they reach the blood? Common signs and symptoms of labyrinthitis.
Oh, vertigo? How about that?
Yeah.
Labyrinthitis?
Imbalance.
What, Joni? Because it just sounded like you said bananas.
Imbalance.
There you go. Least common cause of anaphylaxis. Alternatively, what's the most common cause of anaphylaxis?
Asthma. I'm kidding. Allergic reaction. No, nothing. All right, just gonna go back to drinking.
You're drinking a Monster.
That's not Monster.
Miller.
Oh, he's
Okay,
probably
it
got
looks like
some
a Monster.
like.
If you spin it a little bit, it looks like a Monster on the
Is
angle.
that a White Claw? Is it gonna be a White Claw?
I was gonna get a White
What's
Claw.
up?
I did not plan ahead appropriately and get a White
You guys
Claw.
and your White Claws.
I was gonna get a pumpkin spice latte, but I'm not Emilio.
Little Bailey's in there, you'll be good. Ladies,
Rotations 101.
ladies, you should get this one, right? The normal menstrual cycle lasts how long?
3 to 5
it's
days.
Not all the time. No.
28 days.
How long is
7 to
the
10 days.
cycle? Not
No,
not
4
Oh,
menstruation
cycle's
itself.
14 days, right?
14 days. 14 days.
7. My wife fucking lied to me.
Not menstruation. The
Oh,
menstrual
shit.
cycle
Oh,
from
28 days.
Shark
28
Week
days.
to the next Shark Week.
It's about a month.
28 days.
There
It's
you
a
go.
lunar cycle.
A lunar cycle,
man.
perfect. We talked about
Shark Week to the next Shark Week. That's fucking.
Yeah.
That's,
Yeah.
I'm gonna
Hey,
use
if that's
that
what
one.
helps you. If that helps you, man.
now you'll
I'm
never
gonna use
forget
that.
it. But we talked about, right, how the menstrual cycle is split into two-week portions, but depending on what hormones are going on and when ovulation occurs. And ovulation occurs right smack dab in the middle. So if y'all not trying to have another kid, avoid that.
So can I?
What
So
do
I
you
just want
mean another kid?
I just want. I
There's
just
like
want.
6
Yeah.
kids
She's
taking
talking
the
to
paramedic
me.
class right now.
She's talking to me, and Jonathan. I'm sorry, Joni.
Joni, Joni's got like 5.
Yeah. So
Really?
no,
Joni-
Joni's got
Joni has
4.
5 kids?
Joni
Can't
has
pull out of a
4.
driveway.
Oh, damn.
Joni,
Joni,
Joni
what's your
has
current
4.
child count?
Johnny.
unable to speak.
4?
Johnny's busy
4.
typing. Please, let's not disturb
He's
him.
That he
typing.
knows of.
So Nicole, the what is it? The actual ovum only can survive. What is it? A day and a half?
Yeah, it's like about a day.
So
Sperm,
can
on
you
the other
imagine
hand,
the
is very
odds?
robust.
Yeah. Can you
Gotta
imagine the
travel.
odds, man? Yeah. Like Joni is a freaking sniper, man.
He is. He's got his wife's cycle on his phone. He's like,
Yeah.
today's
yeah.
the day.
Anybody was wondering, Deadpool is on. Sorry.
Watching the game.
Classic presentation of chronic bronchitis. Dangers of positive pressure ventilation.
The lungs.
Also, lowering the blood pressure too much.
Directly related
No?
to lungs.
Directly related to lungs.
Tension pneumo.
Pneumothorax. Thoracic.
Oh, Matt can have his moment.
You're hurtful. Your words hurt.
They're here to motivate. Study for the fucking
Hey,
study.
Joe.
Yes.
Joe, you're getting these questions down, okay?
Yeah, I'm
Okay.
typing. Yeah, I'm typing.
I just want to say, like, because I might have to go on a call or something, but like, I feel like if you
Thank you for your
once
service.
we're done with this,
No, I'm typing. I got the questions down. Plus we
if
got
you
the
distribute
video.
it, then we can like gives us like we can maybe meet again on Saturday, and then we can like find
Yes.
the answers and go over that.
Yeah, absolutely. We're gonna do our second redo. Absolutely.
I like how Jonathan's spidey senses are tingling. He's like, a call is going to happen.
Have I not done this? Have we not been doing this for the last 6 reviews?
I've been to
Here
two
we
of
go.
them. What do you mean the last 6?
Okay, well, welcome.
This is what happens
Welcome.
when you don't show up to all the reviews, Matt.
Welcome to
I wasn't
paramedic class,
invited.
Matthew Levins.
Why do alcoholics bleed?
Because they fall.
Even without that, why do they bleed?
Because alcohol thins your blood.
Seizure versus
Because-
syncope.
So what versus syncope?
Seizure.
Seizure.
Oh,
Oh, it's Easter. You flop around like a fish.
Not necessarily.
are we talking about treatment management or modalities or etiology? What?
Onset.
Onset. God, thank you.
Who can't exhale? Which Matt's doing good.
We're dead.
COPD.
There you go. Answer and question. Ketoacidosis.
Yes. What about it?
Just know
What
what
can
it
we
is.
expect to see in a ketoacidotic patient? Kussmaul respirations.
What underlying condition would you anticipate?
Diabetes.
There you go.
Diabetes, type 1.
Holy shit, guys.
You know,
Take that
it's
test
funny
now,
because
Matt.
on all the questions that we were talking about in class, they were all like related to diabetes. He was getting them good.
Diabetes.
I might be a
Diabetes.
diabetic.
Yeah, you might be, dude.
Bye, Joni.
You guys scare Joni away. Reactive airway disease, characteristics of. Yeast infection of the mouth.
The mouth?
Oh, that's
Dog's
candida
mouth.
something.
Ugh.
Thrush or
There it
candida?
is. There it is. Candida is the yeast name.
I'm sorry, Nicole. Don't hate me. What was that question again that I just answered?
I don't know. You're gonna have to watch the recording. I am like 2-3 questions ahead of
Well,
you.
use
Right now.
mouthwash after you do it.
Yeah, don't let Amelia slow you down, please.
Rubella virus.
Damn.
I'm sorry, what?
Rubella virus.
Rubella.
Oh.
Okay.
I
Well,
have that
signs and
shot.
symptoms.
Do you have your vaccination?
What disease does it cause?
Measles.
Which kind of measles?
Mumps.
We'll look at that.
Ingested poisons. Signs and symptoms of ingested poisons.
Particular poisons?
No, just anything that you have ingested.
Okay, you mean like exterior signs, like things around or other things foaming at the mouth? Those
Patient symptoms.
patient symptoms. Got it. It's like the $25,000 pyramid. I love that game.
This is BLS.
Oh, shit.
It's a
Here you go, Matt.
patient care question. Okay, if you have a patient who has a difficult time breathing, what's your first action?
Put them on oxygen.
If that's not available,
Call for
she's
ALS.
already on home O2.
Fucking bag that motherfucker.
Albuterol.
Hey, Joni.
Think even more basic.
Additional resources.
Stood up in a position of comfort or assist ventilations, BVM.
What was the question?
Position of comfort.
There you go.
Lay her down.
Position of comfort. Got it.
Hey, Joni. Hey, Joni. How you doing?
Joni, you typing now?
No.
That's all right. I got it, dude. We'll come back to this on Saturday.
What condition would increase the risk for aspiration pneumonia? Another question is clinical findings significant or suggestive of pneumonia. What is the toxicological cause of a coma?
The toxicological cause?
Toxicological cause.
I'm sorry, toxicological cause of pneumonia?
Coma.
Of a coma.
Coma.
Glaucoma, I'm sorry.
No, not
No,
coma.
no,
Just
coma.
a coma, like unconsciousness.
Oh, okay.
Damn. Senior citizens,
They
man.
made that
Yes.
question like way harder than
Just
it was
because you
gonna
got
be.
glaucoma don't mean you got to use it on everyone.
Okay, I might have a stroke here. Might be having a stroke.
Oh heavens!
Last known well was
Last note, well.
8:32.
Why did we start 8? All right. This one's I'm going to give you because average age of menopause is
55.
47.
Oh.
55 is
I was
actually
gonna say, it's gonna be
an
like
option, too, so that
mid-40s.
would have fucked you. Yeah, 47.
God, I hate
Which
this fucking test.
I think is not 100% accurate.
Let me call my
I think it
mother-in-law. Hold on.
depends.
It really depends. It depends on this onset, which is why I don't like this question because I wouldn't have chosen it. Because honestly, who cares?
That's a Frank question.
It's a 55. You ask women up to about the age of 55 if there's a possibility of them being pregnant and when their last menstrual cycle was. However, 47 seems really young. It's also commonly associated when a girl gets her first period. So there's girls getting their period at 8. So let's just mark that question as not being useful.
45. Got it. 47.
47. Hallmark signs and symptoms of a pulmonary embolism. If you don't get this question correct, how is mononucleosis transmitted?
What the fuck is mononucleosis?
Kissing
Kissing
disease.
disease.
Kissing.
Oh.
Changing
that kind of
saliva.
mono. I got it. I mean,
There's
I don't
only
have
one
it.
kind of mono.
Oh.
Again, this one should be pretty straightforward. Otitis media.
Oh gosh, that's an ear thing.
Where in the ear?
What is it again? Otitis media.
Otitis media.
Middle ear.
There you go. Sort of
That's
like
what I just said.
Yeah.
like a hobbit might pop out.
Because media.
Yeah,
Media
think
is
media.
the
middle?
giveaway.
Got it.
Oh.
Hormones that control ovulation are secreted from where?
Ovaries.
No. And good news, that's not even an option for you to screw it up.
But the
Pituitary.
Close.
Right.
It's secreted into the pituitary for storage by one structure level up.
Oh, it's
thyroid.
hypothalamus.
Oh, hypothalamus.
Hypothalamus. Joe, that's the fucking word.
That's the connection between the central nervous system and your endocrine system is what? The hypothalamus.
That's it.
So whenever that comes up,
Johnny,
man.
where we going?
Wait, we're gonna go on a quick tour of Joni's house. Hi, Danny. This is the most focused review ever.
Danny won. Look at you in uniform, man. Hawaii 5-0. Let's go, man.
I'm still trying to figure out if Ben is in the shower or not. I mean, can we just point that out?
Ben. You got a picture of him Has he got a picture of him showering?
It looks like the shower curtains. Or just regular curtains.
There's that smile. Oh.
How do you know what his smile looks like? He wears a mask, Matt.
Oh.
Mono.
Monocythiliosis, or whatever the fuck it's called.
So Emilio's offering mustache rides on next Wednesday.
Oh my God.
Jesus Christ, Joe.
Joe, from you thrusting your hips at me to what you just said, I'm going to file a sexual harassment
And
complaint.
Be very
back in the
cautious
smoke
with
in the
sexual
ambulance.
This is
harassment.
mustache rides and
No,
donkey shows. Come on, Joe.
Joe, if you don't come to skills lab where it's a medical tape, I'm leaving the room, bro.
That's true. Joe is always cold, apparently.
It's always one class. There's always one person in every class who's always freezing.
And is it usually the geriatric?
And it's me.
No, it's usually the smallest female. So I'm actually surprised it's not Danielle.
No, well, that's
I
I am the smallest female.
Yeah, you can say that again.
Moving
Zach, I
on.
miss you.
Complications
Oh,
of hysterectomies.
I miss you.
Difference between visceral pain and somatic pain.
Visceral and somatic. Visceral is more generally localized.
Description of the pain, like how one would describe it, visceral pain versus somatic pain.
And he's cheating. He's asking people questions next to him.
Danny, who are you working with? Don't make me go check when to work. Who are you working with? What the fuck day is it?
Who are you?
Somatic is
Hi, Ian.
pinpoint.
You're
Oh,
fired.
there's Ben. There's Ben.
Ben,
That's not a
Confirmed,
shower
no
curtain.
shower.
That's more like a
Ben, Ben, are you
hotel
using a
curtain.
fucking crayon?
What? I
Is
like
that a
red.
fucking- Is that a crayon in your hand?
Oh no, it's a red pen.
Sticking with his red theme. Oh Lord. Okay. What happens if you don't fix anaphylaxis?
Person dies.
Yeah. Why? But generally yes. But what is the main cause of
A
Respiratory arrest.
respiratory
a
obstruction.
non-respiratory issue?
Oh, it's hypoxic. Hypoxia.
Hypotension.
Yes.
Ah.
Yes. But pero why is it hypotensive?
Oh,
Better
God.
why?
I see that all the time. Piss my husband off.
Because why is that? Why are they
Vasodilation.
Oh,
Which leads
Danielle has
to
entered the group.
Check catches
which leads
on
to
fire.
lack of perfusion,
Welcome, Danielle.
hypoxemia.
leave
Shock.
hypoxia behind.
I think that
Systemic shock.
Yes.
Is that the answer?
It's something.
Yes,
really
it's the
similar to
answer.
that.
At least Joan. Never mind. I'll leave Joni alone now.
You better. He's
I don't
not
know.
getting all the answers right.
Oh, you can't get a tube right.
Damn.
Osteoporosis.
That's when you
What
shrink,
about
right?
it? That is a aging disease where the bones become more porous and easily breakable.
But this one's pretty simple. You don't really have. What are your medications for anaphylaxis? I want to say anaphylaxis is probably the #1 tested item.
Epinephrine in an IM 1 to 1,000.
Benadryl.
Benadryl. What else?
Albuterol.
Yes. What else?
A needle to the throat.
Oxygen.
Not in New York. Oxygen. You want to do it, go to
Ibuprofen?
another state. Ibuprofen, no, but for asthma, yes. And sometimes it's hard to tell the difference between asthma and anaphylaxis, depending on how severely they're presenting. So you may give it to them, but then make sure you write it up as a severe asthma. No one will
What
ever
about
come
a
after you.
Is there also steroidal treatment? Okay.
All right, good.
There is
Steroids, yeah, steroids in.
Keep an eye. She's nodding her head up and down.
Solumedrol.
See my bobble. Solumedrol.
Solumedrol.
Now, question or answer or pondering. If you are reading the selections for a multiple choice test, and you're like, I know steroids are in here, and 2 steroids are listed, is that the correct answer?
No.
Emilio, smack you. All right. Common sense. Someone wake Matt up.
Narcan Matt.
Narcan Matt. I'm going to give you this one because which of the following is characteristic of pericardial disease associated with renal failure? Accompanied by an audible pericardial friction rub that occurs during standing.
Is that pericarditis?
It's another
Is
Frank
Babinski
question.
reflex normal for older patients?
No.
What does that indicate?
A neurological injury.
TBI.
Yeah, traumatic brain injury too.
Yeah.
Yeah.
Yep. How does one end the cycle of infection?
Antibiotics.
Look that one up. Family history of psych with a significant stressor.
Post-traumatic. No.
Likely to exhibit what? What is a good blood pressure to maintain for patients in shock?
120/90.
Anything above 110?
She looks so scared right now that we're
I was
answering
gonna
these
say anything
questions this way.
over 100.
90.
90.
We're getting there.
But you were originally.
That's what I was gonna say.
Permissive hypotension is a good thing in patients with shock, because if you try to raise their blood pressure too high, they're not going to necessarily be able to clot, because you do need to slow the blood down to a certain extent so that those clotting factors can actually do what they're supposed to do. Think about in the field, the number one way that we boost blood pressure is fluid. So if you're going to wash them full of normal saline, you're going to take all those clotting factors and make them further apart, which makes it harder for them to clot, and potentially wash new clots away, so you just cause them to be a weepy, bleedy mess.
Okay, so you're talking about in relation to fluid boluses, then that kind of thing. Then.
Yeah, it's
Okay.
not super specific, but permissive hypertension is kind of the rule of thumb. We don't want to overdo it too. Because even if you're treating a patient who, say, for example, is cardiogenic shock, right? The higher you raise the blood pressure, the more oxygen demand you're putting on the heart. And if you have a weakened heart, it's not going to end well if you're trying to boost it up to like the 130s, 140s. Keeping it nice and chill and mellow, and then keeping the patient chill and mellow, best course of action. In order to have an allergic reaction, you must have done what first?
Had be sensitized.
Yeah.
What takes the longest to induce anaphylaxis? Which route? Weakness
Skin?
originating in the nervous system. Nuchal rigidity is a hallmark symptom of what?
That's meningitis.
Meningitis.
If y'all don't get this question right, I'm sending you back to the beginning of 2020 to do this over. Which of the following viruses cause acute respiratory syndrome?
Flu.
COVID.
Thank you, Danny.
Is that actually on the test?
What?
Not COVID,
Oh wait.
but
SARS. SARS.
SARS is the disease, not the virus itself.
The
Measles.
virus would be,
Influenza.
yeah. Is she giving us a look?
I'm
I
giving
can't
you a
see her
look.
right now. I can only see people making noise. I can't see Nicole. She's looking to look
The
disapproval.
the rhino. No.
Starts with an E, ends with a
E-
Rona.
Wait, what?
Starts with a C,
Starts
ends
with a
with a Rona.
C.
Oh wait, coronavirus?
Somebody said corona already.
All I
said
heard was
Corona.
influenza.
No, somebody said
measles.
corona.
Oh, I said Corona.
I
Yeah,
know, I
Dan's-
know. And then they went
yeah.
on a tangent. I said, you said Corona.
I was like, wait,
and I
is
said,
there something else I'm
Thank you,
missing
Danny.
here?
And then everyone was like, the flu. And I was like, how did we get to the flu? Bullshit. What is the most common formed element in blood?
Yeah, erythrocytes, red blood cells.
Coughing up blood in a cigarette smoker is most likely due to what disease?
Zima.
Pink gophers.
I'm kidding. That's not true.
Emphysema.
Viruses.
Look up that one.
No, that's alcohol.
Irreversible shock. If you treat it,
Nothing's gonna happen.
Caucasian patient with excessive skin pigmentation and weight loss. What disease would you expect?
AIDS.
AIDS is like overdone. No one talks about AIDS no more.
Like, was that the one with the iron?
No, but close.
Thyroidism?
Look at your adrenals.
Cancer.
Threats of latent
Addison's
tuberculosis.
disease?
Ben.
What combination of blood will create a transfusion reaction?
You mean like the AB or, okay.
What do intervertebral discs do? What does the retina do? What parts of the pancreas produce
What?
insulin?
I'm sorry, Nicole, you're just going a little too fast. I
Islands of
apologize.
Langerhorn.
So we had retina, and before that, what was the?
What does the
the retina-
intervertebral discs do?
Intervertebral, that's my problem. I can't type that fast. Okay, and I got the retina. Go ahead.
Okay. What parts
they
of the pancreas produce insulin?
Islands of Langerhorns, that's correct.
Be more specific. What is affected by glaucoma?
Eyes.
Hypovolemic shock without trauma. What should you assess for?
Internal bleeding.
Internal bleeding.
What else? What other things too? Good. Purulent sputum is usually a sign of what?
I'm sorry, what was that?
Purulent sputum.
Purulent.
Purulent.
Like purulent.
Yes, purulent, which is essentially the really polite way of saying pussy.
That would be TB or pneumonia, one of those two.
Which both are.
Acute respiratory distress syndrome.
Caused by what?
COPD.
Caused by
Emphysema.
Not emphysema.
COPD. Seriously?
Think on that one. We'll come back to it. What if you have a patient who has an allergy symptoms? What the drugs you're trying to give them? You're doing because you're trying to block what?
Histamine.
At the most basic level, why is shock a problem?
Perfusion.
Antibodies, what do they facilitate? What should you do for a vaginal foreign body?
Keep it in place.
Or grips.
Use the Magelli.
Yes, use the Magelli.
Use that duck thing.
What the fuck? Pap smear?
You know.
The speculum, I think, is where.
Dude, you're like, did you go to OB-GYN rotations already?
The duck.
OB what?
OB-GYN.
OB-GYN. Caribbean gyno.
I know what it is.
Are you sure?
I just like saying the duck
confused.
thing.
The duck
It
thing.
looks like a duck.
It does. It looks like a duck. With little googly eyes on it. I'd be like, I'll go to you as an OB-GYN. You sound like a fun person. Patient with asthma, you're giving a beta agonist to, but you are not able to. This is a BLS question too. You are not able to get the drug to where it needs to be because of poor respiratory excursion of the chest. What should you do?
CPAP.
CPAP, yeah. Thank you.
Yes, but think simpler. Think BLS.
High flow oxygen to the face.
Yeah.
Position of comfort.
More like the high flow oxygen to the face.
Okay.
Stick their head out the window on the way to the hospital.
Okay.
If a patient has shingles, it means they had what as a child?
Chickenpox.
All right, I'm going to give you this one too. Epididymitis in young men is usually a resultant of which infection? Let's see if anyone gets it for the $200 Jeopardy question.
Young men, epididymitis. Oh, is this the genital thing?
Yes, this is the genital thing.
Yeah, okay. And this is the gory picture of the scrotum in the book?
No.
Is this the one that fucking Rob took a picture of? Sorry.
Epididymitis.
Epididymitis. I can't say it. The
Epididymitis.
The non-inflamed version of that is the
testicular portion.
No, they're the testicular. Oh, speak of the devil! You say Rob,
Oh,
and he pops
varices.
up into the freaking room. Hey.
Pharisees?
It's when it gets blocked.
It gets blocked, but why? What?
Usually caused by,
Bacteria
like, an
or virus? Yes. Which STD is
STD.
causing it? Which one?
Chlamydia.
HPV.
No, HPV is not
Chlamydia?
really a big deal. Neisseria gonorrhea.
Gonorrhea.
You probably would have gotten that because the other options are like vaginalis, which dudes don't tend to have vaginal problems. Another one that I've never seen before, and then herpes, which is probably what would have thrown people. Patient with COPD. What's the primary goal? Patient's in shock for an extended period of time and has cold extremities. What else would you observe?
Give him oxygen. Give him ipratropium. Give him albuterol. CPAP him.
Who invited this guy?
What? The cold extremities? Where did you come up with all that? Isn't that your bolt? Your blanket
Your body-
oxygen elevate?
Yeah, you are.
and
Your body's
transform?
shunting away. It might be cardiac.
I'm fucking lost.
He's thinking
Yeah.
too
Just
much
ignore
into it.
me. It's the end.
Rob-
It's the end of my shift.
No,
I
Cole,
apologize.
Rob doesn't have to
You're
get.
the loudest one in this group right now.
He just
So
had
Rob,
to fuck everything up.
Rob, go
just-
away.
Hang on. Let me tune Rob in for a second. So Robbie, can you hear me? Robbie, can you hear me?
Loud and clear.
Okay, so listen up. Well, here's what we're doing. We're prepping for a Saturday review. I'm just taking notes. If you got the good answer, throw it out there. So I can type it down. Otherwise, we're going to save it and review it and have it ready for Saturday.
Sounds
All right.
good. That's the proper
Thank-
way to speak to someone. Thank you.
Oh, no problem. Thank you.
You,
Here
Rob.
we go.
Who the fuck is Bobby D, by the way?
He's Robbie. Come on, let's go.
All right, moving on. Clinical findings suggestive of a neurological emergency.
Anger.
Anger.
That's-
What do antibodies help the body differentiate between?
Good and bad.
Sort of. Very close.
You're
I mean, they
surprised,
recognize-
right? So am I.
Whether or not you've, it's antibodies would have to do with the previous infection, immunization.
Also think of antibody issues in transplant patients.
Okay, rejection. Whether or not your friend or foe, autoimmune.
There you go.
Got it.
What gets to the blood first after eating? Which component of food?
Protein.
No, sugars, blood glucose, right?
That's why you have them drink or eat. 'Cause it-
John.
You're here. Yes. It's like the Brady Bunch. Everybody's like hanging out. If you're trying to improve vascular resistance in a patient with shock, what would you administer them?
Dopamine.
What kind of drug is dopamine?
Dopamine is a vasoconstrictor.
Older adults with septic shock, what's one of your main sources of septic shock?
Yeah.
BLS, main critical aspect of treating a patient in shock, regardless of cause.
Bleeding control.
Elevate feet, keep them warm.
No, elevate legs, keep them warm,
Oxygen.
put oxygen on.
And what are you doing after that?
Transport.
Rapid transport.
There you go.
Bolt. B-O-L-T.
I love that when the BLS guys too, be like, all right, cool, we're gonna do this, 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 and this. Like, all right, great. Now what you doing? And they're like you're just gonna sit out, hang out on scene,
Your turn.
just chill. We like it here. It's nice in the ambulance. All right. How is rabies spread?
Dog bite.
Zombies.
Through blood.
No, not through blood. Go back
That's
to
an animal
bite.
bite.
Go back
Yeah,
to bite.
bite.
What component
Similar
of being
scratches.
bitten?
Saliva.
Saliva.
Epi treats what type of shock? Or an
Anaphylactic.
EpiPen, yes. Elevated white blood cell count of a patient having a seizure what could be the cause?
Infection.
Yeah,
Infection.
infection.
What are some other words for
I-
infection?
Sepsis.
Sepsis.
How about like a pocket O infection?
A pocket O infection.
Yes.
Are you talking about a joint infection, like a septic joint?
No, but that's really good. I like that. It's usually, these are usually seen in like dental work.
Oh, abscess.
There you go.
Think you guys, if you guys haven't watched the $25,000 pyramid, think $25,000 pyramid when Nicole's talking.
Now that everybody's gonna go back to Netflix, like, what the fuck is he talking about?
Yeah, exactly.
Organizational chart for county health agency should include which officer?
The DECO.
Yes.
Chief medical.
No.
No, DICO. DICO.
Oh,
Infections Control Officer.
thank you.
Insulation. What insulates an axon?
The myelin fiber.
Myelin sheath.
Myelin sheath.
What do platelets do?
They clot.
Systemic lupus can create this disease in many patients. This is like.
Is that is this the skin hardening?
Nope, that's scleroderma. My both
Is this
favorite
like the
and least favorite.
easy bruising?
Think more.
Is that the rashes in the face, the redness?
That's the hallmark sign for lupus is that butterfly sign. But going beyond, if you have lupus or really almost any autoimmune disease, and we talked about this when we were in the cardiology section a little bit. It's not necessarily how high your cholesterol is, it's how high your inflammation is that causes problems.
So systemic lupus causes chronic inflammation?
Well, it's an autoimmune disease, so yes.
Okay, all right.
But
which would create cancer? No?
Think cardiology.
Pericarditis. No, I saw. Why do I want to keep saying that?
I don't know. Look that one up.
Yeah, okay.
Difference between a pathological fracture and a just a regular old fracture.
One's caused by trauma, one is caused by disease.
And this is also related to bone marrow, some sort of I can't think of the name of it, but some sort of bone marrow deficiency, maybe?
Potentially.
Okay. We'll come back to that.
Yep. Going back to the question where Emilio shouted out the answer delightfully. If you are exposed to something, who should you tell?
Infection control officer.
There you go.
Your supervisor.
Depends on who your supervisor is. Don't call me Danny. Call Brian. Just call Brian. I've got one more day of vacation. Don't call me. Because I'm just going to call Brian anyway. Be like,
I saw him today.
Yeah? Is he still gray? I left him alone for like 2 straight weeks. He's going to be very happy I'm back. All right, moving on.
Scheduling questions.
If you have a patient who's snuggling a bottle of Oxy, what are you going to be giving them?
Narcan.
That's Emilio right there. Narcan man.
Ingested poison, what is your main management idea? What is the main function of the immune system?
The main function of what?
The immune system.
The function of the immune system is to protect us from outside invaders.
What is the definition of orthostatic orthostatic changes, not hypertension, for the pulse. What is the numeric that you're looking for when a patient goes from sitting to standing?
The difference in blood pressure, you mean?
The pulse rate, because it's
The
blood
pulse?
pressure
Oh,
and
pulse rate.
Oh, what's like the change?
Yeah, what's the change that you note?
20? Going down by 20 for us?
It's gonna go.
It's gonna go down.
It's gonna go down.
Not the pulse.
Pulse would go up.
There
Okay.
you
Is this
The
okay,
pulse would
but
go
we're
up,
looking
yeah.
for the number,
The
right?
pulse would go up
Yes.
because
What is exactly? How much? What is in significant? What is just considered significant? What is an abnormality of the spine? Corneal
Kyphosis.
corneal abrasions. What is a symptom of a corneal abrasion? Who will give you an which kind of patient will give you an inaccurate pulse ox reading?
Hypothermic.
someone that or someone who has CO poisoning.
Okay. Which, and this is like which patient are you most likely to give vasopressors to? You would expect patients to be hypertensive and tachycardic following what kind of overdose? Or following all of the overdoses except? This is BLS. This is so BLS. If you have a patient who's developing shock, what would you expect to see?
Diaphoretic skin, cyanosis, a bunch of other. I'm trying.
A bunch of other things. Stuff.
Oh, I'm trying to, engage the rest of the class.
Low blood
Put it out,
pressure.
Jonathan.
Yeah.
All right. Cystitis. Definition O.
Cholecystitis, you said?
Just cystitis.
Cystitis.
Patients on the autism spectrum are usually comforted by what?
They're usually pretty touchy.
Ben, you all right?
Like Down syndrome people?
No, like
No, autistic isn't Down syndrome.
Autism spectrum comforted by what you say?
Yeah, what
Like-
is comforting for patients in the autistic spectrum? We talked about
Compression?
this during the lecture.
Family.
Sometimes the family sets them off.
Music.
Music.
They
They
like
like to
music.
be
They wear
compressed.
headphones.
Music, yep. I don't know. Compressed is not a.
According to the accountant, they like guns.
We'll come back to that one.
That one I know for a fact we did in the lecture. Which is up on the classroom BT dubs.
Is that just explaining stuff to them, what you're doing? Like explain everything you're doing?
That's a good part of it, yes. Life-threatening anaphylaxis affects what part of the body? Primary treatments for bronchospasm. Where does bleeding originate from in an epistaxis?
Nose.
Which part of the
Nose.
nose?
Inside
Interior
part.
aspect.
The
It's
inside.
usually interior. Septum.
So scared.
Patients with renal disorders, what is an important part of your assessment and patient care? If you don't get this one, I'm gonna slap you because the answer's in the question. Answer's in the question.
It's Kisselbox plexus for the previous one.
Yes.
Yes.
Body's primary response to shock. barrel chest appearance is caused by what? Difference between preload and afterload. That's a throwback to cardiology. If a patient is hypoventilating, what would you expect their blood and
basic.
acid levels to be?
They're basic. Too basic.
No, it'd be too acidic.
Yeah,
Built-
because you need the oxygen too,
Not releasing.
so it'd be too acidic.
So if a patient's
They're gonna be
hypercapnic is like, put an asterisk on that word.
I was saying it looked like it was offside. But
Memory
no.
cells.
They're in
Where did they
isolated bubble.
from whence did they come?
You said memory cells?
Everyone has
Memory
to be
cells.
tested constantly. Like every day, the players in the bubble have to be tested, and when you're eliminated from the playoffs, you have to leave the bubble.
Who's that crashing our party, man?
Sorry,
that's all right. Go ahead.
It's hippocampus, right?
No, we didn't ask anybody about hippocampus. We didn't even make it there. We were listening to basketball.
Hockey.
Memory cells origin.
All right.
We'll come back.
Islanders are shit in the bed today.
It's tied.
Yeah, they had a lead. They had a lead. Like every other New York hockey team, except for Buffalo Sabres, which everyone forgets about and just gives to Canada for fun. We try so hard, we do so well. Oh, we're so close. We're just gonna stop playing now.
Man, I think we hit a button.
Yeah. All right, sports fans, let's concentrate.
Arm drift to the Cincinnati stroke scale. What kind of shock is caused by attention pneumo? The difference between pre-renal, intrarenal, and post-renal disease. Young child, croup-like cough, difficulty breathing, and a high fever.
What's the treatment? Is that what this is a patient treatment or assessment?
Disease?
Oh.
Which immune system cell causes a runny nose during an allergic reaction?
Histamine? No, I'm sorry.
I mean, technically, but who holds on to the histamine before releasing it to the wild? I guess
you said a cell? Which cell?
Which immune cells hold histamine?
Leukocytes?
They're the confetti cells of the immune system. Like when these guys explode, they set out histamine and leukotrienes and kinin and bradykinin, and they're like, poof, and they just kind of explode.
Oh, are these the basals? No.
Look it up.
All right, we'll comment. Yeah, cool.
Decayed tissue. Which disease process is that? If a patient has an adrenal gland tumor, what disease might they have? If you have a patient who's been in shock for an extended period of time, what would you expect their blood work to look like?
What the fuck?
This would be a of red blood cells. Thrombocytopenia?
No.
Okay.
Think back it up to less complicated. And bring it back to, if you don't have enough blood to get to the lungs, What waste products are going to build up?
Oh, your carbon dioxide, elevated carbon dioxide.
Which in turn shows up as
Acidosis,
there we go.
respiratory acidosis.
Yep. GCS of what is indicative of a severe brain injury?
12 or less? 8 or less? Keep going. 4. 4? All right.
Close. This should be easy. That you should know.
So I love when you skip over the that you should knows. And somehow I feel that this contributed to the.
All right, so
just to test this
the
on this one. That you should.
Contributing. All right, hold on. Let's sort of put this in a way it doesn't exactly read the question. What is a contributing factor of a stroke brought to you by the cardiovascular system?
Atrial fibrillation.
See, you should know this one.
I wouldn't have got that.
Joe, can
Shut
you
up,
please sit
Matt.
next to Matt during the test?
Matt's
every once in a while.
Matt just likes to play this. He's got this thing. He likes to play it.
So sad.
So I'm stupid, and it's not.
My
He's
cardiology exam says otherwise.
You don't know what your cardiology exam was.
Oh,
You've yet to actually get your score.
I got the inside source.
It's not real. Why is history taking important for a sexual assault victim?
Evidence in court.
No, turn the lawyer off.
Oh yeah, sorry. Let's step it back to medical treatment.
Exactly.
Well,
leave it just there at that sentence.
Yeah. Okay. Got
that
it.
that sums it up nicely.
Yeah.
If a patient threatens suicide, what should you do?
Encourage them.
Jump her down.
Kick them off the ledge.
Yeah.
Basic functional unit of the kidney.
Nephron.
Inflammatory response is which line of defense in the human body?
First line.
First line, yeah.
First line.
That's not right, Joe.
The first line of defense is your skin.
So this is a second. So inflammation is secondary. Yeah. Okay.
Facts, yo. Generic form of glucophage.
Generic form of glucophage.
The medication glucophage.
Got it.
Rapid toxin exposure is due to which route?
Injection.
What causes
it could be
esophageal varices? Sorry.
Portal hypertension.
Warm flushed skin, protruding eyes. What disease? Signs and symptoms of a status asthmaticus. Signs and symptoms of an abscess. The most basic, like don't think too hard about that one. Like basic.
Fever.
Pus filled, red, inflammation.
Suspected thyroid problem, what should you assess?
I'm sorry, once again.
I don't like this one at all.
Okay.
When trying to diagnose a patient with a suspected thyroid problem, you should assess skin temperature.
True.
Yes. True.
50-50 chance.
And you don't like that because why? Since thyroid problems.
The other options are shit.
Okay, but thyroid, if you had a thyroid problem, that would affect temperature.
Yes, it would.
Yeah.
But the other options are: is there sweating? What's the patient's blood sugar? And is the heart rhythm normal? And all of those are also things
equally
to check.
valid.
Yes,
okay.
equally valid. So fuck this question. Glycogenolysis. Definition
That's
of what causes it.
creation of glucose or glucose from glycogen.
Produced by
And
what
it's
hormone?
insulin. No, glycogen.
Glucagon.
Glucagon, sorry, glucagon. Confused.
It's
I
okay.
was close.
Sign or symptom of acute renal failure.
Uremic frost.
That's more chronic. Uremic frost is definitely a little more chronic. It can be seen in acute, but most of the time it's like somebody who's been on dialysis for a bit of an extended period of time and their body's just like, I don't know where to put this. I'm gonna go over here and put it on the skin.
These are like pretty common, aren't they? Like nausea, vomiting. No?
Tinnitus.
Really?
What?
Really? Acute renal failure equals tinnitus?
Apparently, yeah, you see the face? The face says the same. That's why I gave you that answer.
No shit. Because I'm having a serious case of tinnitus like all the time. I don't feel like I'm having any problem with my kidneys.
Should go
All right.
check. How many
Yeah.
milliliters of urine have you put out today?
Over 2,500. I'm sorry, over.
Over 500. Over 500. Don't confuse everyone.
Yeah.
Signs and symptoms of a panic attack.
Anxiety, tachycardia. What did you say, Joni?
I said numbness to the extremities, fingertip.
That'd be hyperventilation, wouldn't it?
Which is very common.
Which is anxiety.
Oh, I get it. All right.
Yeah, South Jamaica has a shit ton of those.
Yo. Jamaica. If you want to know what a panic attack looks like from about 50 paces back, work a shift in Jamaica on an ALS truck, and they'd be like, he's having a heart attack. You'd be like, nah. The finger like this. Come on, walk to the truck. Let's go.
So Nicole, I know that you've had your fair share of like excellent calls on stuff that was bullshit, but have you ever like been like bitch slapped by one that you thought was bullshit, but it wasn't?
I've only had one that was in memory, and it wasn't 100% like of a bitch slap in so much as like my partner was like, I have to pee, let's just go. And I was like, okay. Guy came in complaining of, he was like, yeah, you know, like I've got stomach pain, I've had dark sticky stools. I'm like, all right, cool. GI bleed, no problem, right? She's like, let's go. I'm like, all right, let's go. Like, I have no problem like rolling with this. I'll get the blood pressure and everything while we move. Got the blood pressure. His blood pressure was fine. Didn't put him on the monitor because I was like, he was younger. He was like probably like in his late 30s, early 40s. I was like, all right, cool. So he's sitting on the bench, and his wife is there, and all of a sudden he just goes, bleh, and just vomits up black coffee ground emesis and like syncopizes. And I was like, son of a bitch. And I was like, I need a hand, because now I had to like flip him onto the stretcher. And like we were just around the corner from the hospital, so I was like, you couldn't have waited like 5 minutes, bro. Like 5 minutes before you vomited everywhere.
Without warning.
Yeah, it's never, vomiting is never with warning. Like,
really? I carry an emesis bag on my side for that. Before they go, I don't feel so good.
Yeah, see, the ones who go, I don't feel so good, are the ones who can kind of control it. And like, you should be like, don't vomit, and you get the bucket, go, now vomit. And P.S. Pro tip, 5x8s in the bottom of a vomit basin. Delightful. Absorbs the splash. Because not everybody has like the emesis sock.
The cone of forgiveness.
The cone of forgiveness. Yeah. But the people who are just like, huh? And you're like, oh, sweet baby Jesus, what just happened? Like, those are the legit sick people. The people who are just like, I don't feel good. Like, they're the ones who like got a little food poisoning. You know, you're like, you're fine. You're fine.
It's coming.
It's coming. Yeah. Patient positioning. Another patient positioning one. Signs and symptoms of epiglottitis. You should get that one. That's no big deal. If you suspect a patient has delirium, what is essential to get when you're doing a patient assessment?
Patient history, medical history,
Like no, like beyond that, like actually your physical exam.
head injury.
BGL.
Oh, altered mental, right. Thank you. Common sense.
Difference between COPD and like asthma.
Bronchi and wheezing.
More like the progression of the disease.
Progression, COPD is a much longer over time progression. Asthma can be more, it's younger. COPD is older.
Does asthma change pulmonary structure long term?
No.
No. Emphysema.
What hormones do the adrenal glands produce? Why are inhaled toxins?
Oxytocin.
Oxytocin is from your anterior pituitary.
Does this have to do with urination and so forth, like the corticosteroid or cortical?
Corticosteroids, yes.
Okay.
Not,
Metabolic.
think more vasopressors.
Got it.
Why are inhaled?
Aldosterone. Sorry, was it aldosterone?
Yes, but not what we're looking for.
Oh.
Vasopressor. We got it. Come on, stay with it, man. Fast on the button. Let's go. Yeah.
He was being
Quicker.
important. I saw the bat phone in the background. Typical pain anticipated to be seen in a patient with a gently leaking abdominal aneurysm. Why are inhaled toxins so dangerous? If you are going to a nursing home because your patient has a low hematocrit, what would you expect that your patient is doing?
Internal bleed. Thank you.
I don't know. It's not my patient. I just got here. Patient with bacterial endocarditis. And this is not something you're going to do on the ambulance because we just don't do like that. What are you going to assess to make sure that they are functioning properly?
Bacterial endocarditis functioning properly. Okay. Further research required.
Just think vegetation.
Okay.
That should narrow that down. Where are blood cells produced?
Bone marrow.
Bone marrow.
Signs and symptoms of an ovarian torsion.
Extreme pain.
What's some of the more subtle things too? Look into some of the more subtle signs.
Tenderness.
What happened?
What?
I think you got that one.
Matt, did you just wake up, man?
I'm here. I'm just watching hockey.
Term used to describe the pathogenicity of a virus.
Epidemiology? No, pathogenesis terms. Okay.
One more for your bacterial endocarditis. Oh, go ahead.
I'm sorry. So pathogen, like how it's contracted, or how it proceeds.
Look at the pathogenicness or pathogenicity of a virus.
It's okay. Pathogenesis is its origin and transmission.
Mm-hmm. And how successful in that transmission it may be. Look at that part of the textbook.
Okay, got it.
Virulency.
That's BLS. This is a quirky one. The feet of a patient who has bacterial endocarditis might have what? That's a Jeopardy question. That's like a 200. Like, I'll take random medical knowledge for 200, Alex. Just look up endocarditis. Just review endocarditis.
Somebody look that up while she's talking, please.
Anticholinergic bronchodilators.
Anticholinergic or cholinergic?
Anticholinergic. All right, I'm going to give you this one because ain't nobody give a shit about this in emergency care.
Atropine, anticholinergic bronchodilators. Oh, albuterol. Thank you. No.
That's a sympathomimetic.
Anticholinergic bronch.
It's in the same protocols. They go together. Peanut butter and jelly.
What is it? The other thing with a combo.
Albuterol, and the other one's the steroidal one, the Solumedrol.
No.
No?
Come on, Matt.
I can't think of it.
I see the little tiny deer.
I got nothing.
All right, we'll get it right on the test.
Better get it right on the test.
I'm gonna fucking get it right now.
Type it in, man.
Check your protocol. This is why it's important for you to keep your protocols and like line them up so that you can make the connections.
Especially since we're doing ALS scenarios next week. They're throwing a bunch of shit at us next week.
Yeah.
Test, fucking skills, retests, Wednesday class.
I can't. All right. Clinical findings of spermatic cord varicocele. I don't think I said that right, but we're going to go with it. Varicocele.
Varices.
Hypertropium.
Thank you, Matt.
You're welcome.
That's the
I don't know. I made varicocele a freaking.
That's the varicocele. Is that? Wait. So let's go back to the anticholinergic bronchodilator.
Hypotropium.
Hypertropium.
Yeah. Feel free during the commercial hockey break to look up an answer, so we don't have to do so much work.
Or at least shout out the freaking score.
1-1.
Game 6, right?
Okay. And what was the next one you were on? Clinical what?
Exactly. Clinical findings of spermatic cord varicocele. I don't think that's how you say it. I'm just gonna make it sound like a pasta. Include a palpable soft, irregular mass to and above the testes when the patient.
Yeah, so this is called a varicocele. That's what it is.
Exactly.
It's a varicocele.
Varicocele. Varicocele. But you put a little Italian spin on it. You put a little pesto, a little Parmesan.
It's fragile.
So basically, we have to indicate what's the physical finding, like to pull down your pants. Let me look at your scrotum.
Yeah.
And feel it. Okay, got it.
Take their word for it and transport.
Yo, can I just tell you, the offenders who are the worst when it's like, I have testicle pain, old ass dudes, like 75 and older, they're like, let me take my pants off. I'm like, no. Keep them on.
Smart.
I believe you.
Joe, you get it.
Yeah, I do. Absolutely.
Terrible.
I'm always looking for an audience, man.
Add a tap.
Dude, it's only 20 years away, man. Okay, look, I'm not gonna tell anybody when my birthday is, but I turn 55 in December, okay? So we'll be done, I won't see anybody, but man, that's 20 years away. Can you imagine?
So it's after the 16th. All right, got it.
No, maybe before the 16th.
Anyway,
let's go.
Conditions that are most commonly associated with DIC.
DIC? Oh, this is, I remember this one's a really long three-word DIC.
You know who you should ask because he did a really good weekly assignment on that one? Rodney.
Who's the person who did it?
Rodney.
J. Rob, man.
We have a Gerardi in our class?
Bro.
Oh, Williams?
When Zach stopped hanging out so much, you would know.
No, his name's Williams. No, his name's Williams.
When the light goes off, it's not. I think it's broken.
Come on, dude. He's one of our veterans.
It's true.
Thank him for his service.
What?
Darius is in the house now.
Describe how the hypoxic drive works.
Hypoxic drive.
Have a good night.
Good night.
Blue, purple, or red discoloration on the skin is most suggestive of what autoimmune disease? And no, not lupus. The answer is not lupus.
Is this the thrombocytopenia?
No.
Nah, that's
I don't think there's a single
lack
question
of
about variants
platelet.
with thrombocytopenia. That would be like
Okay,
more
great.
Haiti.
Thanks
Or
for that
Katia.
tip.
Excuse me.
Leukemia?
No, autoimmune, not cancer.
Autoimmune. Lupus. No.
Nope, not lupus.
Jesus Christ.
Not lupus.
Not lupus.
Not lupus. All right. Remember, somebody should be typing. Guessing.
This is a trauma question. A BLS trauma question. Best way to detect deformity or abnormality in an injured extremity?
Palpate.
If you no.
No, you can
All right.
visually
That is an
inspect.
option. Yes.
You go no, compare it to the other extremity.
There you go. What happens if they don't have another extremity? You done shit out of luck.
Then you just take a guess, compare it to yours, maybe.
Oh, that was a fun story. When they took cardiac arrest, guy died in his kitchen, diabetic, and there's a kitchen table full of diet soda. And by a kitchen table, I mean like a full-sized kitchen table with a leaf, 100% covered in like standard-sized cans of diet soda. And I'm like, what in the bejesus is going on here? So I go to move him, because I was always that person who's like, I'll move the patient, no problem. I go to move him away from the table because he was kind of underneath it, and his fucking leg popped off. And I'm standing there with a leg, like, I handed it off to a fireman. I'm like, do something with this. I don't know what to do. Amputees,
The
man.
prosthetic.
Yeah, his prosthetic leg just popped right off.
Of course it was.
And then
I don't know.
Thank God. No, so my brother's a
This shit
radiologist.
gets kind of weird.
My brother's a radiologist, and they had this one in his hospital. They had this one image go viral. It was an image of a leg, right? So it's an X-ray of just the leg, and then like the foot's over here, like not attached. The CNA had gone in the morning to help the patient go to the bathroom, and patient couldn't ambulate. So she puts the patient back in bed, calls, and they hey, patient can't ambulate. So they go in. Why did you take this X-ray? Well, the patient was complaining that they couldn't ambulate. The foot wasn't attached. It fell off in the middle of the night because she had gangrene that she was refusing to have treated whilst in the hospital. And her damn foot fell off, but her chief complaint was unable to ambulate.
Okay. Little detective work there.
Yeah.
Foot fell off.
Could you imagine
Which
though,
is
like,
what
changing the
condition?
sheets? Gangrene. Fell off due to
Yes.
gangrene.
Well, isn't that like, yeah, but it's something necrosis or something where it actually falls off, shrinks and falls off?
Yeah, well, dry gangrene.
Okay, yeah.
Yeah. But can you
All
imagine,
right.
like, you change the sheets and all of a sudden, like, a foot falls out? Like, oh.
I had this conversation with her. I can't believe people let themselves do that. Let their extremities fall off.
You know what? Sometimes you're just like, I don't need this foot, I guess. Which D of stroke management is the public responsible? Yes, that one, Matt. That one, definitely.
What happened?
I was waiting for an inappropriate response from you, and you let me down, and I'm really upset right now.
I you know what? If I feel like if I make an inappropriate response, it's just not going to end well in my favor. So I kind of just refrain from it.
Okay, so which D, like in quotation marks, is of stroke management is the public responsible?
This one.
Thank you. Major organ of the gastrointestinal system.
The stomach.
Yeah, but it's from the list. I'm not going to give you the list.
Obviously, it's a choice that doesn't contain three of those that are not part of the gastrointestinal system.
The most obvious, yes. The most obvious ones, like stomach, won't be there.
Pancreas, I think, is probably in there. I've seen this question before, man. It's the pancreas or...
Anyway. If a patient's blood pressure keeps spiking then dropping, what are you the patient? What is the patient having an issue with?
Circulation.
Probably vaso
Homeostasis.
restriction or
Go with homeostasis.
Hemostasis.
Go with homeostasis. Follow that rabbit hole into how is homeostasis maintained?
by hormone.
Think simpler.
No,
Simpler. Loops. Think loops.
I didn't learn this acronym. This
No, not acronym.
mnemonic.
Just think loops. When you look in
Loops
the textbook.
like Skywalker.
No.
Like Skywalker.
You're the boss's wife, right? And she's out.
Just stop fucking.
Luke.
Loops.
Somebody help Nicole back. There she is.
Loops.
Out of alcohol.
L-O-O-P.
I am out. You see this? I'm out.
You cannot allow that to happen, Nicole. There's no
I
way
can't
you're
get up and go
completely
to the
out.
fridge. The dog went to bed. He can't even fetch me nothing from the fridge. I have to teach him that. That's on my next thing to do. So far, we taught him grass, which when we're walking, I go grass, and he jumps up on the grass because there's a car coming usually.
Okay, so BP swings caused by something, which we'll find out later.
Yeah. CLF. Crohn's disease. Which statement is true about Crohn's disease? What connects muscles to bones?
Tendon.
Thank you. What
Tendon.
connects bones to bones?
Ligaments.
Oh shit.
What's up, kid?
I see you.
Who will progress from compensated shock to uncompensated shock the most quickly?
Children? No. Old people.
Same thing.
Opposite of opposite of babies.
Yeah.
That's simple enough. Signs and symptoms of a rejected kidney transplant.
Fever, swelling.
What else would go in that little trifecta?
You'd have some sort of
Tenderness.
renal failure, wouldn't you?
Tachycardia.
Basic. No, super basic. Super basic. I think DCAP less. Basic.
Like tenderness.
Decap BTLS?
I guess I'm sitting to her left.
You are. You're
or
sitting
her
over
right.
there.
Or over here somewhere.
I
All right.
gotta go over Joe. To Matt. There you go.
God damn it, Joe.
Hollywood
Which
Squares, man.
cardiac medication has the smallest therapeutic window?
What the fuck is it? You gotta put it in the left arm because it's got a short fucking
Adenosine?
Never mind.
Which cardiac medication is most likely to be toxic first?
Oh, Digitalis.
Joxer.
Digitalis.
There you go. That's easy. That's also easy.
Is it though?
Clubbing.
What is
I don't
that?
mean, like-
That's that.
Hypoxemia.
There you go.
Hypoxemia.
See, all I gotta say is clubbing. Hypoxemia. There's the answer.
I have no idea
Danny
what the fuck
wants
you're talking
dog
about.
shows up.
Long-term
Let's go.
hypoxemia causes clubbing on the fingertips.
Thank you.
Let's go clubbing, man.
Make sure
Joe,
you
it's past your bedtime, man.
I'm starting to fade, man. Let's get this done.
Joe, man, keep those fingers working, baby.
Corticosteroid therapy versus bronchodilator therapy. What's the difference?
Well, doesn't one reduces inflammation, the other one dilates the bronchioles.
Metabolic,
Yes.
something corticosteroids, something that has to do with metabolism.
No, think time frame.
Think what?
Time frame.
Oh, bronchodilators work faster, and corticosteroids take much longer.
Difference between a poison and a medication.
Dosage.
Yes, and so much as a poison is a poison no matter what the dosage.
Yes.
Birth control pills increase risks of what?
Pregnancy.
No. Cancer. Breast cancer, right?
No. Think
Okay.
shorter term cardiovascular.
Stroke?
A little lower in the body.
Lower in the body. Heart disease. No.
Next door.
Okay. Next door.
Next door to the heart.
Gallstone.
PE.
Thank you, Ashley. Thank you.
Who
What
said
did
it? Oh, finally. Finally.
What'd
From the
she say?
females in the group, where have you been?
Why would pregnancy?
Yeah, no, it's definitely not pregnancy. Birth control pills are have the antithesis, like the end result of
Ashley-
that. PE.
My two kids.
Plot?
My two kids say otherwise.
Well, you say PE or?
You also don't know how long a menstrual cycle is, so I mean, really,
Okay.
whose fault is
So-
that?
Like
Ashley,
Russian
what was
roulette
it
over
again?
here.
What was it? What was it?
Pulmonary embolism.
Okay,
Oh,
and so
I
Ashley,
just
can you
said
please
so.
speak up before the male knuckle draggers throw in their answers,
I
please?
just want to see what you guys would say first because it's always entertaining.
Yeah,
Yes.
it's good
Yeah.
to sit back and just listen. You're like, oh my
Yes.
lord, what's going on? Oh my goodness. All right. Which type of shock are you most likely to recover from?
Hypovolemic.
Anaphylactic?
I'm just kidding. That was a joke.
Actually, psychogenic.
I mean, that's not an
Wouldn't it be?
option, but yes. Like,
Okay.
I feel so shocky. I better know. If you have a patient who has a hoarse, muffled voice who you suspect is an anaphylaxis, what should you be prepared to do?
Epinephrine.
Intubate.
Wait.
Great.
Seriously?
I beat you, Joni,
Seriously?
again.
Because so
Crikey,
okay,
guy.
so we're gonna intubate, but didn't you say? I know it's gonna be. Is it gonna be epinephrine versus intubation in that answer? Maybe no.
No, epinephrine's not an
No.
option. So
Just pick
Okay, good.
intubate.
That's not an option, and that's great because otherwise I'm thoroughly confused now.
well, you should be
Got it.
you should be prepared to intubate versus
Got it.
you should administer epi. Like you
Got
know,
it. I got you.
sprinkle them with some like epi. Like, you feeling better yet? No. Cool. BLS. It's not even BLS. That's like second grade. You had a seizure kid in your class.
Remove sharp objects.
Literally the answer, more or less. It's
I am fucking on a roll.
Protect them from their surroundings.
yeah.
Pass this motherfucker.
If you better motherfucking pass this test, Matt.
So
We'll
Matt,
see.
you just pretend when you're holding your iPad or your iPad's in front of you taking the test that I'm actually holding it for you.
And then I'm just looking
Okay.
over the top of it like,
Joe,
Yeah.
I'm just gonna sit behind you because I know you put like 3 times zoom in on those fucking questions.
Dude, that's fine, but don't fucking put the answer in that I put in. Whatever you do. Okay, because I'm only right 85% of the time.
that's
I'm
still
only
better
right
than he's doing.
63% of the time.
All right, so figure out that differential then.
No.
What EKG abnormalities are suggestive of a cocaine toxicity?
Tachycardia.
Tachycardia.
Okay, a little more specific, as in
Yes.
intervals or like the changes of stuff.
Narrow fucking yeah. I love cocaine. I mean,
Just the way it's
like that. Yes.
Why QRS complexes and PT weight?
That's more hyperkalemia, not cocaine.
Well, isn't that narrow complex SVT? Is that what we're talking about? Like super fast heart rate? No.
I tell you what. Next Wednesday, Monday before the test, I'll do a couple lines and just throw a 12 lead on me.
Okay, so we're gonna put that in for further research.
Yeah, that's good, but not Matt. Don't let him help.
No, we're too much talk, not enough action, but that's all right.
Coming in high now.
All right, so remember that other question we talked about, like what's the cause of death in a severe allergic reaction? And then Joni popped up with like the answer. Question here phrased slightly differently.
There's hypotension, but so
What
This
else
is again would
What
be
else would you call hypotension? Like when it's like to the point where like I guess you're gonna die now.
well, that would be irreversible shock or
Cardiovascular collapse, perhaps.
yeah, sure.
There's some buzzwords for you. Where are neurotransmitters traditionally found in abundance?
in the brain.
Yes, sort of.
I think it's in relation
Smaller.
to the
Think more
yeah.
microscopic.
in the synapses, or is that right? No, synapses. There we go. Thank you.
Pancreas, endocrine, exocrine, both, neither.
Ooh. I'm sorry. What was that? Say that again.
Pancreas, is it exocrine, endocrine, both, or neither?
Okay. Remember we had this conversation, everybody, about duct or ductless.
Yeah.
Endo.
Endo, exocrine. So pancreas delivers insulin and also glucagon, right? And that is done via
bloodstream.
If it's exocrine, it would be a duct transmitter or deliver. It could be both because there's two. Yes, I'm gonna go with that. Endocrine or exocrine? Let's say both. Wrong.
I'm sticking with endo.
And this is why we don't listen to Matt. Moving on.
What the fuck?
All right, so we'll figure that one out. Pancreas is one of the two, or both.
People at the highest risk for ovarian torsion. Oxytocin's role during birth. Going back to think of loops.
Oxytocin has to do with contractions. Yes.
Mm-hmm.
No.
Yes.
Yes. Oxytocin has to do with contractions, and vaginal delivery of the baby. Obviously, timing of contractions and so forth.
Why is airway management challenging in patients with ankylosing spondylitis?
God, my dad has this. I'm gonna have to call him and ask him.
Hey, if I was going to intubate you right now, why would it be hard? I'm going to give you this one. UTIs account for how many visits to physicians' offices every year?
7 to 10.
10 mil. 10 mil.
10 million?
10 million. 10 million visits to physicians' offices every year.
And how many of those would be women? The majority, right?
Probably the most of them. And the rest of them are like elderly patients. What is the main cause of chronic kidney disease in the industrialized world? And last but not least,
Alcohol.
Sugars.
Sugars. No, sorry.
Diabetes.
Yes, but think broader.
Metabolic syndrome.
Less specific.
Frickin' frack. I can't think of it. We'll get to
Zach's
it.
not here.
Last question.
I got this.
Typical signs and symptoms of sinusitis.
All right, I don't have it.
Sinusitis.
Sinusitis, inflammation, headache. All right. So, Cole, before, I don't know, you can jump up, but if you can't jump up because it'll cut out the meeting.
I can hand off the host to somebody else if you want.
Can you please, just for a moment, can you hand it out to me so I can talk to my fellow classmates?
Do you have any questions before I go?
No, but thank you very so much for taking the time out of your vacation and all the things that you do. Thank you.
Not a problem. All right, hold on. Leave meeting. Oh, your iPhone. That's why I couldn't find you.
Yeah, usually I don't know why I changed it to my name, but.
All right. Have a nice night, all.
Thank you, Nicole.
Yeah, thank you.
Bye.